Welcome to the Mayo Clinic Health System Women and Wellbeing Refocus on Resilience webinar. I am Stephanie Olson from Mayo Clinic Health System and look forward to hearing our guest speakers. Welcome, and also you will be receiving an electronic survey at the end of the webinar. Please take time to complete this survey. Your feedback is valuable to future webinars. I would like to introduce our first guest speaker, Gretchen Zinsli, a certified nurse practitioner in the Urology Department at Mayo Clinic Health System in Owatonna and Faribault. Gretchen earned her master's degree in science from the Walden University in Minneapolis, and she is the medical director for the Free Clinic of Steele County. We allowed time for questions for her presentation, so please submit your questions during her time, and we will take them at the end of her presentation. Please welcome Gretchen Zinsli. You're muted, Gretchen.
There we go. Hello, everyone. It's nice to see you today. As Stephanie said, I'm Gretchen Zinsli. I'm a nurse practitioner. I typically work in the urology department, but I also do some family practice on the side. Today, we're just going to talk about taking care of you during a pandemic, because it's been a little strange. Okay. So as women, we typically like to plan things. We have planners and calendars, and we keep track of where everyone needs to go, whether it's our family members, whether us, work, home, we're all busy. 2020 started out as a pretty typical year. We were all busy, overscheduled. It was rare that there was a day on the weekend where you didn't have something planned. And then we started hearing about COVID. So in March, things were getting a little more worrisome. There were cases that were showing up here in Minnesota, and people started to get a little bit stressed out. Mid-March, when we had the government, or when the government shut things down to protect us, that's when everything changed. Work changed, our home life changed, and healthcare changed. One of the things that we saw happening was that people were afraid to come to the hospital. And people were afraid to come to the hospital for things that they really needed to be there for. Emergency rooms saw a huge decrease in visits for things like heart attacks, strokes, uncontrolled high blood sugars, because people were afraid to come in because they were afraid that they would get COVID. Now, when someone has a heart attack or a stroke, we have protocols in place so that when someone comes to the door, comes in with symptoms of a heart attack or a stroke, typically it's from the time they come in, we have 60 to 90 minutes to get them to the cath lab or wherever it is that they need to go. People were waiting days to come in because they were afraid, which means that instead of being able to fix the problem quickly, they're having long-term problems from waiting so long. There was a survey done in June of this year. 41% of the people that were surveyed delayed all healthcare. And the people that were delaying healthcare were unpaid caregivers of loved ones. So that means people taking care of their parents or their spouse or their children or their neighbors or other loved ones were not taking care of themselves. And that's when things can get kind of piled up and start getting worse. 12% of people delayed going to the emergency room in general, which is a lot. Emergency rooms saw fewer people coming in. There were fewer people coming in for non-emergency reasons, but again, those people not coming in for really emergency type of things, that is more of a problem. And then another trend that we saw that is also concerning is that people were delaying preventative care. And that's care to see your family practice provider or your internal medicine provider and all of the other providers that you see. Don't delay your care. So throughout COVID, things have been changing. And around here, sometimes we feel like we've figured out how this is going to work and what we're doing, and then it changes. And we're trying to keep up, patients are trying to keep up. Our goal is to keep everybody safe, whether it's all of the employees here at the clinic or the patients. Those of us who are moms or even, well, all of us wear clothes, I suppose. We all have that mountain of laundry that appears sometimes. And my mom likes to do laundry, so she literally does a load of laundry every day. I don't work like that. I do laundry when I run out of underwear and socks. And if I've waited all that time until I'm out of the essentials and everybody else in my family is out of essentials, I have a huge mountain of laundry that now is just overwhelming. Whereas doing a couple loads a week, things are okay. Kind of the same thing in healthcare. And that's why your primary care is so important. That's what helps you keep things under control that if they get out of control can be kind of a big deal. So this is just a graphic from the World Health Organization. And I really like it because it describes primary care really well. Primary health care covers the majority of a person's health needs: promotion, prevention, treatment, rehabilitation, palliation, from birth to the final days of your life. Your primary provider is kind of like the conductor of your health train. So your primary provider is the one that's checking your labs when needed, getting you in for your mammograms, pap smears, all of the different things that you need, keeping you up to date with your vaccinations. The goal is that if we can see that something is starting to change, we can get a hold of it before it gets to be a really big problem. And, kind of like keeping control of our laundry. It's just keeping things in perspective. Now, most of the work that I do is in the urology department. And so we hear comments, we'll have patients say, well, I just nope, I'm not going to come in until the COVID stuff is over. Well, it's going to be a while. And we don't want people to be gone that long. And we need to be keeping in touch with them and keeping all of their healthcare going, because we don't want little problems to become big problems. Here in the world of urology, sometimes we have to talk to men in ways that they understand it a little bit better. This is from the American Urological Foundation or Association, and it helps us talk to men about, when you're in the 18 to 40 stage, that's when you need basic care. When you're 40s and 50s, it's time to start watching your gauges, meaning we need to start watching your blood pressure and cholesterol and things like that. Older men, 50 to 70 and up, you need inspections. And so this is just a way that we can describe to people how things change as we're getting older and all the things that we're trying to prevent. So I just kind of like that graphic. So with all of these things changing with COVID, we needed to meet the needs of the patients, because honestly, some of the visits that we were having with patients don't need to be in person. We can do a video visit and fix things and still keep in touch with our patients And it was something that when we were looking at our goals for 2030, that was something that was, that's where we're going to get. COVID kind of pushed us right over. So it's been really amazing because we didn't have time to sit around and be worried about it and what about this and what about that. We kind of got thrown into it and we all just dove in, and it's been great. So there's different ways that you can stay in touch with your provider, and we can stay in touch with you. The patient portal is an amazing resource. You can see all of your notes, your labs, your radiology, everything is in there that you can see. We also have a lot of patients who have elderly parents, and their elderly parents may not be able to get on the portal, but there's ways that we can help their family members that are their caregivers be on the portal so that we can still communicate with those patients. We also do what's called e-consults. So if we have a patient that has, in my world, if we have a patient that has, say, urinary tract infections that are recurrent and difficult to treat, we can do what's called an e-consult. So I put in an order for infectious disease. An infectious disease doctor from Rochester will review the chart, make recommendations, and send them back to me. And then I can make more plans with my patients. It's a really nice way to do things. We also have video visits. Video visits are changing and improving all the time. We can listen to heart and lungs. There's a lot of different things that we can do with the video visits, and our patients have been very happy to have them. We also have a remote monitoring program. A lot of patients with congestive heart failure, this works really well for them. They have a blood pressure machine and a scale, and they have a tablet, and they put their information in every day. And if everything is stable, then great. If something is off, then the nurses from that team call the patient and see what's going on. We also, our mobile app, I mean, you can be on the portal on your computer, but you can also be on the portal on your phone. And as a patient, I have to say the app has been great. You can do pretty much everything you need to do from your phone. Another thing that we've done that's been really great to help people continue to get good medical care from home is with our pregnant population. One of the really difficult things with COVID is we don't really know, it's taking a long time to learn things, especially how it's going to affect a pregnant mother and how it's going to affect that baby. So we want to limit their visits in the clinic as much as possible. So we send them home with blood pressure monitor and a little ultrasound so that they can monitor the fetal heart rate. And then they can have their video visits and for some of the visits, and then come in person for the ones that they need to be here for. It's been a really great option for our OB patients, and they've been really pleased with it. Another thing that's been in every department, another thing that's all of the specialty services have been very worried about in all of this is cancer care. What if you have cancer during a pandemic? Well, we don't want to just not do anything. We're going to treat you the best that we can and give you what you need so that your cancer stays under control. In general, it worries us that people are avoiding coming in or waiting to come in, because if you have a small, for example, a prostate cancer or a breast cancer, and it's a stage 1. Well, that's a lot easier to deal with than if you waited 6 months and now it's spread outside where it's supposed to be, and it's much more difficult to treat. We've been continuing to do chemotherapy and all sorts of other cancer treatments because we want to keep all of that under control. And we just encourage you to continue to do all of your just to keep going with your appointments. Physicals are also important to have. Okay, so part of all of the changes that we've been having is we all have new routines. When you come to the clinic, you're stopped at the door, they take your temperature, ask you a bunch of questions. You come in, our waiting rooms look like they're empty because we took out all the extra chairs. And it's really kind of nice because it makes us feel safe and it makes the patients feel safe. So we want you to get here so that you can come in and be seen. Because when we do need to see you in person, we want it to be safe for all of us. It's also been a big change with wearing masks. Those of us in the healthcare field, we've been wearing masks pretty much all day, every day since March. This is actually the first day that I've worn makeup since March. So it changes things. As far as social distancing, it's so hard because we all have loved ones that we want to see. We have loved ones in nursing homes and assisted livings, and we have to be so careful because if one person gets COVID, it's going to spread. And we have to social distance, but there are ways to see those people without feeling so isolated. There's outdoor visits when the weather is nicer. There's people that are on each side of the window. They'll sit outside someone's window. And it also, it's very difficult because we're all used to going places and seeing people here and there and chatting with people. Now that we're not going out and doing all the things that we used to do, you don't have those conversations with other people. And that's where you have to work to not isolate yourself. As far as how to do that, there are so many different ways to stay connected with people. My college girlfriends and I were usually absolutely busy all the time. During COVID, we started having 5 o'clock on Friday, happy hour. And we just have a Zoom call and we talk for sometimes a half hour, sometimes 2 or 3 hours. It just depends what's going on. Now that things are getting busy again, it's not happening as often and we really miss it because we typically wouldn't see each other or talk to each other that much. Writing letters has been amazing. Getting a real letter or card in the mail from a friend or a relative is really kind of cool. It makes the receiver feel good. It makes the sender feel good. And you also just have to be creative when you're thinking of ways that you want to be in touch with people. And it's hard. It really is. I mean, none of us want to get our family members ill or anything like that. You just have to find ways to be in touch with people, but not be touching people. The most important thing with all of this is to be kind. We need to be kind to ourselves. We need to be kind to others. We need to be mindful of behind the masks, everybody has something that's going on. Everybody has something that's stressful in their lives. And you just never know what it is. So just be kind to the people that you see when you're out in public. Be kind to your neighbors and friends. Be kind to your healthcare providers. Spread kindness like butter is a saying that I ran across. And I think that's very true because we all love our Hope butter, but spread your kindness like butter and it will make everyone's day a whole lot better. I'm ready for questions.
Thank you, Gretchen. Does anyone have a question? Please use the Q&A feature in the Zoom. Gretchen is here to take questions and answer questions. I appreciate the time, Gretchen.
Not a problem.
This is new for all of us with the webinar and visiting with Gretchen. And what I hear about when I'm in the clinic it is the most important thing is don't procrastinate your regular care. I work with the physicians closely, and that is so imperative that we do come in for your regular care.
Yep.
Even in the community, you can hear it from your friends and your family members. I'm going to wait, and please don't wait.
No.
Are there other questions? Again, Gretchen, thank you for your time and your talent. It's always a pleasure to see Gretchen from time to time. I get to come to the clinic, wear our masks, and I always know there's a smile behind that mask. So thank you, Gretchen.
Absolutely.
And now it's my honor to introduce Sister Tierney Trueman. Sister Tierney attended the College of St. Teresa, Winona, receiving a Bachelor of Science in Biology and Chemistry, and received a Master's of Science in Education, Leadership, and Administration from the University of Alabama. She has taught throughout the world nearly 40 years. She served as president of the Sisters of St. Francis and served on the National Board for Leadership Conference for Women. Currently, Sister Tierney is the coordinator for the Values Council, Mayo Clinic in Rochester, and volunteers pastoral ministry for the Spanish speaking at the Federal Medical Center, and as a translator at the Our Lady of Guadalupe Free Clinic for Immigrants in Worthington. It's been my honor to listen to Sister Tierney. This will be my third time I get to hear a message from her. So please welcome Sister Tierney.
Hello, and thank you. I'm delighted to be here. And Gretchen, I just want to thank you. I didn't have a clue what you were going to be sharing with these people, but you've laid this wonderful foundation for me to keep going on. So thank you. Appreciate that.
Absolutely.
Okay. I think I have to give you one disclaimer. Stephanie, I'm my paternal grandmother, and she raised 7 boys. My father was the oldest of 7. And when I was about 4 or 5 years old, she told my parents she didn't think they'd be able to raise me. So I think there's something, when I titled, well, this kind of gave a title to this, I said, I'm quoting Mary Oliver, what are you becoming with your one wild and precious life? So that's what, and I'm going to focus on, our beautiful, I love the text of our value statements as a Mayo Clinic employee, and especially healing. Notice what we say. Inspire hope, that's our Mayo mission, inspire hope and nurture the well-being of the whole person. Gretchen, you spoke beautifully about that resilience in terms of particularly the physical, mental. I'm going to invite us to look at our inner life, the spiritual. Now, for some people, that's a religious, but every one of us has an inner life, the spirit that drives everything about what we do because of who we are. That's what I want to invite us to a few minutes of reflection. So, you, wonderful, marvelous, unique you. No other person on Mother Earth ever has or will have the same DNA that you have. I don't think we can ever forget how significant my life, your life is in the whole creation plan of our God. Okay, so you and becoming, we're always becoming. Growth is, but we're growing, what's the invitation? How do I want to grow? Grow into being and becoming more or having more? And I think our world challenges this. Sometimes I think we almost feel like I am what I have. I am who I am. And that's what we want to look at in terms of that inner life, that great gift of change. An image that I read in an article, the idea of, we are sailing a ship, the ship of your life as we build it. You're on it, it's secure, but we keep growing, we keep building. And it's very interesting in this whole COVID, and I'm not oblivious to the incredible pain and struggle that too many people have faced. For a couple of months of my furlough, I was delivering $100 gift food cards and $25 fuel cards to all kinds of people in Rochester that have been out of work since March and needed food. I mean, I've been to these trailer courts in southeastern Rochester, kids in school, out of school, but April and May, but no Wi-Fi. So, I mean, I'm certainly aware of some of the intense suffering that's been a part of that. But I think there's another piece we can ask ourselves. How in this COVID, all the realm of the suffering and the creativity you mentioned, Gretchen, how are we possibly being invited to a new and different way of being? not just doing, but being. I think that's the key. So inspire hope, that's our Mayo mission. I ask each one of us, is that also my personal mission? Inspiring hope? And think of the world we're living in, so much violence, so much struggle, so much pain. Is that part of my personal mission? So a word I love and how we describe healing is nurturing. That's a very feminine verb, in all due respect to any of the men that might be on this presentation. And one of my, honest to God, one of my very favorite scenes, I love to watch a mother nursing her child. That will stop me dead in my tracks. If I'm going through an airport, it's one of the most beautiful images, I think, and it's been portrayed in a lot of art. That mother is, yes, she's feeding her child, but she's caressing that child. The warmth of her body is warming that child. She's talking to the child. She's nurturing the whole life in that child. And believe me, as a teacher, she's giving the foundation for a sense of self-confidence and security in that child that will serve him or her all the rest of their life. So nurturing. So today, I want us to look at nurturing that inner life, our spiritual life. And very interesting, in our Mayo Clinic history, we go back, Dr. Will, back in the exact date, Saturday, December 18th, 1926, message or a headline actually in the Cappers Weekly, a Topeka, Kansas paper. This is the quote of Dr. Will. I have seen a minister come to the bedside of my patient and do for that patient what I could not do, though I had done everything in my professional power. That inner life, that spiritual life was as important to Will and Charlie and WW and the sisters as caring for the physical and the mental. And he also, at another point, stated, this is from the book, The Mayo Brothers Heritage, one meets with many men, say women, who have been fine students, who stood high in their classes, who have great knowledge of medicine, but very little wisdom and application. They've mastered the science and failed in the understanding of the human being. By the way, I forgot to mention, I will be using some quotes, and I've done this previously and people have asked me for them. So I sent, Stephanie has the list of quotes that you don't have to try and write them down if something sort of connects with you. You can have the list of quotes at the end of this presentation. But I think it's so important to remember where we come from. We didn't just fall out with the last rainfall. We have a strong foundation in our Mayo Franciscan heritage. So my question to each and every one of us today is, how do I nurture my inner life so that I become and continue to become someone who inspires hope in the lives of others? And I do believe in the world we're living in today, I can't think of any greater challenge. Two quotes. Martin Luther King says to us, life's most urgent question. What would you think is life's most urgent question? Take a minute. For you, what's life's most urgent question today? And here's what he says. What are you doing for others? Life's most urgent question. What are you doing for others? And our Franciscan theologian, St. Bonaventure, he reminds us how we choose and what we choose makes a difference. How we choose, what we choose makes a difference. First, in what we become by our choices, what I become by my choices. And second, in what the world becomes by your choices, by my choices. We live in a world. We're not just isolated individuals. We are made to live in community and in relationship with one another. So I'll come back to those two questions. What are you doing for others? How we choose and what we choose makes a difference in our lives and in the world we live in. So for me, there's three parts about that. Gratitude is the first one. I have to confess, no, I'm not confessing, I'm grateful. I think, take for a minute, and you probably can see yourself reflected on the screen. Okay, we come from our parents. We have gifts that we've received from our parents, and I think that should inspire gratitude. Somebody's probably told you, oh, you have your mother's eyes, or you have your father's curly hair, or disposition, or height, or whatever. What are the gifts you've received from your parents throughout life, your friends, your acquaintances, your gifts of the inner life, the treasures from which all that you are flow? What are those gifts deep within you and that you treasure, you would hold very carefully and very preciously? For me, it's I say to I have 3 siblings, and I say if we forget everything parents ever taught us, we would never forget to say thank you. I think we're genetically programmed, in all honesty. And for my mom and my dad, it was not just saying thank you. You know, we delivered the fresh loaf of bread, the plate of cookies, to say thank you with some object in a sense. And let me assure you, that sense of gratitude that permeated our lives was born of great pain. My father was killed prematurely when I was 9. My sister was 11. My brother was 5. And we had a little boy that we were 2 weeks from having had for a whole year. We were adopting, so my little brother would have a little brother. And my little sister was all of 6 weeks old. She had been born the first week of December, 2 months premature. My mother was in extremely fragile health, and my dad was killed. So, and out of that, I mean, when it was like somehow mother, no matter how much we were very poor, but mother always reminded us we have some reason to be grateful for, even that suffering can bring to us. Meister Eckhart, middle ages, if the only prayer you ever pray, if you're a person of faith, is a prayer of gratitude, it's enough. And I think that could be translated, if the only action you ever take in a given day, a given week, is some expression of gratitude, it's enough. It's enough. Interesting. We've done over 120 some values reviews across the whole enterprise in the last year and a half. And 2 threads that go through everyone, clinical, non-clinical, from the general services up to physicians, surgeons. We don't take enough time to affirm one another, which is a form of gratitude. Say thank you. That, and we can always improve communication. So I want you to just close your eyes for a minute and think of one particular gift, at least one, that you know you have received from your parents, your family, your grandparents, that you treasure. It's an inner treasure within you. Just think about that. Maybe write it down on a piece of paper. Okay, gratitude, especially for the gifts we've received. Secondly, I believe that the gifts we've received, because we're social people, are meant to be shared, to be given away. I think that's the second. And the satisfaction that comes to us when we truly give something, not necessarily a thing, but do something, present, spend. I think every one of us has had at least one experience, and the sense of satisfaction that comes to us in knowing that somehow something about who I am has been able to be really appreciated and valued in the life of the other. I do prison ministry. I haven't since February, federal medical prison, because they've been in lockup. But because I speak Spanish, we have the Catholic Mass there every Friday night. And I'd go out and I would do the scripture readings with them in Spanish. Then we would continue with the Eucharist in English. And very interesting, you never give something away either that you don't receive. I've learned to look at life through the lens of a prisoner. You don't ask them what they did, but some of them will tell you. And one gentleman who was trying to earn money and got into the drug traffic, and he said to me with tears running down his face, probably 40 years old, "Ni siquiera pude comprar un refresco por mis hijos." I couldn't even buy a treat for my children. These are good men who've made some poor choices. The choices we make, our lives and others. So again, think about something that you've done, or maybe you do on a regular basis, that you know at the end of the day, maybe you're worn out and dead tired and frustrated, but there's a sense of satisfaction. You've given something of meaning to another person. And I think it's all about relationships. And part of that, learning to receive in order to give. It's mutual. And our history as Mayo, go back to that famous tornado, Dr. W.W. and Mother Alfred, when he asked her to help care, and she goes back and says, don't you think Rochester needs a hospital? Totally opposed, no, couldn't raise the money, wouldn't succeed. And she said, okay, we'll make a deal. We sisters will raise the money and build a hospital if you and your sons will design and staff it. They shook hands. Our foundation as Mayo Clinic employees is about a relational vision together. Without either part of that relationship, you and I wouldn't be here today as Mayo Clinic employees. And I think what's so important about that, she was a Franciscan. Francis saw everyone as brother and sister. He chose to study chemistry under John Dalton, the Chart of the Elements. Dalton was a Quaker. Judith Hartzell, in her recent biography, points that out very clearly. She called Dalton a mentor in the Quaker belief and heritage, Dr. W.W. Mayo. And a couple of those beliefs, women are equal to men. 1883, he shook hands. The trust between Mother Alfred and W.W., mutual trust. That's a taproot of our foundation. And also the Quakers, you best serve your brethren by helping them become all they're fully functional, all they're called to be. Our teamwork. You and I are better together. The patient is better together. Our colleagues are better when we do it together. Very interesting. A gentleman, his name is Stephen Schwartz. Because I knew you, I have been changed for good. How many people, you've got people that would say that to you. Because I knew you, I've been changed for good. How many people might you want to say that to? And you will be changed. It's a relationship. It's an exchange. Brandon Stanton, who's a photographer, he's kind of goes with Mary Oliver. Doing anything less than something amazing is squandering the whole reason that you're here. What do you want to do with your one wild and precious life? Anything less than amazing is squandering. That's a pretty strong verb. So I was one of those male colleagues that was on furlough for 4 months. In my whole life, I've never been a week without a job, without full employment until COVID and furlough. And what a gift that gave to me. I mean, I knit, but how many baby blankets are you going to knit for the volunteers? How many books are you going to read that you've got stashed up? How many times do I take this little dog for a walk? You'll wear out. I called our sisters, 98 of them that live at Assisi Heights, are in quarantine to their floors. There's 6 different floors. So I called and offered my services. If anyone has to go to the clinic, I could go with them. And I ended up doing that. I've never in my life had that opportunity to spend the kind of time. 3 of our sisters had fractures that required surgery. I was in their hospital, the one guest or supporter, stayed with them throughout those days. So I spent about almost 4 weeks in the hospital. Your point, Gretchen, I began to appreciate what's it like to wear a mask all day. I don't wear a mask when I'm home here. I wear it when I mean, the kind of, what can I learn? And our whole value of compassion, trying to feel and be sensitive what others are experiencing. These sisters, I asked one, tell me about what missions. We have many of the rural towns in Minnesota, Ohio, that we taught school in. I taught here in Rochester. And this sister, who was there are 8 children in her family, she was the second. They lived on a farm. Her mother died when her youngest sister was born. So at 12 years old, she's now the mother of the family. And her suffering, it was like, wow, her whole life. And then she said to me, and I know who this sister is, but if you don't live with someone or work, you don't really get to know them. She said, Sister Tierney, I wasn't a good teacher. I never liked to teach. And yet her mission, she taught all of her life. And she said, I was moved every 2 years. And I look back on that. The pain was still in this beautiful, there's a calmness about her, but the pain was real. And I think in our community, she got moved every 2 years so there wouldn't be a reputation in a particular school that she's not really a good teacher. I mean, how do we care for the many ways? I did take those food cards and I'd ask people, and many of these are in the Southeast Rochester speak Spanish. ¿Cómo está? How are you doing? Bien, being good, say more. Well, we have our faith, we have our health. And these are people out of work since March. I mean, touch, how do we allow, the furlough gave to me a time, and I don't mean to undervalue at all the terrible pain and suffering, but personally it gave to me a participation in some of that suffering. I began to feel what I never would have seen or felt before. And now with the whole race, everybody in the learnings at my age, I'm appalled at what I did not know about how the kind of systems that protect my white supremacy and cause great suffering, discrimination, and disparities in the lives of others. I think the challenge is there. And one thing, technology gives us, you could communicate in lots of ways, something beyond those quick text messages. Ours is a culture of encounter. Our value-driven culture is a culture of encounter. And what's missed when we don't have the time to be present and be a part of others. So I'm going to ask again, how do I nurture and care for our one wild and precious inner life? And isn't that where your passion is? I think there's 2 things. Okay, first of all, have a place and a time for some kind of solitude, 5 minutes, 10 minutes, something. And I quote to you, Kathleen Weflin is or was the editor of the Minnesota Conservation Volunteer. And she says, to be productively engaged in society, not ruling out that piece of our life, a person also needs a way to get away from it all. Whether we look for a place of solitude, a time for quiet reflection, freedom to become absorbed in a keen interest, we are escaping to reconnect with the essence of who we really are. We are escaping, women aren't good at that, to reconnect with the essence, that inner deep life of who we are. St. Francis said, be all you're called to be and be that perfectly. Not your neighbor, not your, be all that you are called to be that perfectly. And dear Kristen Armstrong, I think she's the ex-wife of Lance. She has a blog. She reminds us our greatest accomplishment is not our to-do list. Now we've all got them. I've got a list right over here for this afternoon. That, she says, is not our greatest accomplishment. Out of her faith belief, she says, rather the person we become when we allow God, and I suggest our interrelationships with one another, to transform us. And she further says, what we focus on expands. And that takes us back to that question. How we choose and what we choose makes a difference in what we become and in what the world becomes because of us. So a couple of reflections, if you want to think about what might help you in that. St. Francis, this is Richard Rohr, says, Francis was a master at making room for the new and letting go of what was tired and empty. What baggage do we sometimes need to let go of, put it down? It's tired, it's empty. It served 5 years ago, but it doesn't today. Racism. What might you see? How do you see the gift to me in living 31 years in Colombia? How do you see difference as in mutually enriching, not dividing us? Take a walk in Mother Nature. That for me, Mother Nature, and allow the beauty of any moment you've got to stop you with the incredible red of the maple trees this fall, to inspire you to take in new life, refreshed and renewed. And think of that image of that mother breastfeeding her child, holding and nurturing. That's what Mother Nature can always give to us too. When you go out there, feel like you're just being embraced in Mother Nature and all the love and the tender affection of Mother Nature. From that incredible story, Les Miserables, I love one of the lines of a song, to love another person, to love. Go back to that beautiful image of the 3 giraffes, is to see the face of God. You look in, especially someone suffering, you are looking in the face of God. Interesting, in Latin, the word for mercy, misericordia, is loving from the heart. How do you love from the heart? Who might you need to love from the heart today? And then dear Frederick Buechner, I believe he's a Protestant theologian, he says, out of a faith context, the place that God calls you to be is that place where your deep gladness, Dr. Ferrugia's joy, where that deep gladness and the world's deep hunger meet. How and what choices you make determine who you become and continue to become for our world. If you watched the Everybody In session last Friday, they began and they closed with a song called Be a Light. In a time of war, be peace. Be. In a time of doubt, just believe. Just believe. In a world of hate, be a light. When you do something wrong, make it right. Don't hide in the dark. I love it. Don't hide in the dark. You were meant to shine. What do you want to do with your one? Who do you want to become with that one wild and precious life? In a place that needs change, make a difference. In a time of noise, just listen. Just listen. The world of hate, be light. Thank you for letting me be with you. I'm delighted to have been able to be a little bit a part of this. Thank you, Stephanie, for bothering to organize, and for the help of Jason and Kathy in this too. So blessings to each and every one. Be good to yourselves. If anybody has questions, but I don't know.
Sister Tierney, there are many people saying thank you for the wonderful inspirational message. You definitely have shared with us in the sign of darkness today to be the light.